You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. The topic for today's show, is there a need for something beyond the mammogram for women with dense breast tissue? The key unique feature of U-System's automated breast ultrasound machine is the reconstructed coronal view. These are the views that are sliced parallel to the chest wall. This view is very easy to interpret for a radiologist who is not an ultrasound expert and is very, very sensitive in revealing abnormalities in the breast tissue. Preliminary studies are also showing that it can be used to discover the elusive type of breast cancer responsible for 15 to 20% of all breast cancers, called lobular carcinoma. This particular type is often missed by the mammogram alone. The purpose of this show is most importantly not to spread alarm to the public, but to offer a very viable solution in addition to the mammogram to those women with dense breast on a population-wide basis. We're all about good medicine on the program today. The purpose of the ACRIN, or the American College of Radiology and Imaging Network study, the abstract presented nationally in November with publication to follow, is to compare the outcomes of mammography alone to a combination of mammography and ultrasound. This was conducted on over 2,500 women with non-fatty breasts. This study found that adding screening ultrasound to the mammography increased the diagnostic accuracy of screening and found more breast cancers, including early-stage breast cancers not seen on the mammogram. So what are we looking at here?
What we're going to look at is some examples of patients that have come through that have had mammograms and ultrasounds, where either the ultrasound reveals abnormalities that the mammogram has picked up, or the ultrasound finds lesions that were not seen on the mammogram.
Okay.
So in this first instance, you're looking at a two-view mammogram, and you can see that there's a mass in the posterior aspect of the right breast, a couple masses in the left breast. We're going to a different view to see another.
So you can see those differences, because to me I can't really see the differences.
I can, but it's because I'm trained in, and this is dense breast tissue, so it's a little bit hard to pick up. This one you should be able to,
yes,
you have the feeling that there's something around here. So now what we're doing is comparing the mammogram on the left side with the coronal reconstructed ultrasound done on the automated machine on the right side. And you can see here's the mass, and here's a perfect simple cyst. And you can tell because it's pure black inside, there's nothing inside of it, and it's very finely outlined.
So what I'm looking at on the right is an ultrasound image. This is a mammogram image.
Correct, but this is not just any ultrasound image.
So it's just a hole. You see a hole.
This is a thin section coronal image, and by coronal I mean sliced parallel to the chest wall. And this is just more examples. This lady has multiple cysts in her breast, and this is going to be coronal images and traditional images, traditional ultrasound images, because your handheld ultrasound is going to show you a very similar thing. And here's a cluster of simple cysts. Same lady, other breast. And this
What's that?
This is a gorgeous picture. This comes from Dr. Tabar in Sweden. He has a three-dimensional large section microscope, and you're actually seeing cysts under the microscope, three-dimensional pictures of cysts, so that you have the direct comparison to the ultrasound.
So ultrasound picks up, so you find something on the mammogram.
Right.
You do the ultrasound.
Correct.
And then it shows this, and you're able to tell them instantly that day, you're okay.
Right. Here's your papers, you've graduated, everything's fine, see you in a year.
The ultrasound is not used as a screening device, early detection device yet. Is that right?
That's 100% correct, Randy. As far as what's nationally recognized by Medicare and the insurance companies.
Will that change?
I'm sure hoping it's going to change. A lot of us are doing research right now trying to prove to the insurance companies that having ultrasound as an adjunctive method to the mammogram, meaning as a second screening study, is going to find so many more cancers than mammography alone. Not to throw out the mammogram, it's important, it cannot be replaced. But by adding ultrasound on only when the breasts are optically dense on the mammogram, we can probably double our number of cancers detected.
If it was your loved one, would you tell them not only get a mammogram, but always get an ultrasound?
If they have dense breasts, absolutely. And I do that with my family and myself.
Okay.
Every year. It's important. We talk about yearly mammogram. If they have dense breasts, they need yearly ultrasound too. Let me show you what we're talking about with this next case. This is a lady who came into my center for a screening mammogram. And these are two of the views of her breasts. And you can see there's a lot of light-grade tissue. These are the mammograms, and there's a lot of light-grade tissue, meaning that they're optically dense. But there's no masses, there's no abnormality, there's no distortion.
So this is a good one.
This is something that you would call a normal mammogram.
All right.
Anybody reading this who's a trained breast radiologist would say this is a normal mammogram.
Okay.
And the lady would normally receive a letter stating, your mammogram's fine, See you in a year, basically. Now, because we had a trial going on in the center with the automated ultrasound, and she had dense breasts, she was invited to have this automated ultrasound of both breasts. And these images are incredible. These are serial coronal images of her right breast. Yellow dot again represents the nipple, and you can see here there's this irregular gray area just lateral or to the outside of the nipple, about 1 centimeter to 1.5 centimeters in size, that's consistent through all these slices. Not seen at all on the mammogram. And here you're looking at the same, you know, before you called it a black hole, I'd call this a gray hole with some distortion around the outside. So it doesn't have that the clear nice lines of the cyst. It's irregular.
So whenever I'm looking at this, I'm clear. If it's a clean circle, you're okay.
Black,
jagged edges,
black and a clean circle.
But jagged edges.
Or gray and a clean circle isn't always okay.
So in this part, the fact that it's a little cloudy.
Exactly. It's
makes
gray,
you think there's something going on.
a little heterogeneous, irregular margins. You can't tell exactly where it starts and where it stops. That's pretty consistent with a cancer. And then this upper view here shows you a traditional ultrasound view. And you can see that it kind of looks like a stellate or asterisk type looking abnormality. And it's got central shadowing. These are all characteristics of a cancer on ultrasound. And then these are just microscopic pictures once we did our biopsy. And this was found to be a cancer, grade 2 cancer, which means a moderately aggressive cancer. It was 1 centimeter to 1.5 centimeters in size.
So mammogram missed it.
Mammogram missed it.
Ultrasound picked it up.
Correct, and her lymph nodes were negative, and she's going to be just fine. She had a lumpectomy and some radiation.
Possibly saved her life.
I think we definitely
saved her life. So with a woman like
life.
that, she had a mammogram. It was fine. She was sent home for a year to say, it's fine.
She would normally be sent home, yes.
But what could have been happening, she was sent home to let her cancer in her breast grow. For a year.
Not the fault of the imaging method, not the fault of the mammogram. It's a wonderful screening tool, but it's not perfect.
But our system is set up, the healthcare system is set up to not cover ultrasounds unless, I guess, you have...
Unless there's a problem.
Unless there's a problem.
Right.
So because she had no problem, she didn't get an ultrasound, would have gone home with cancer growing in her breast, probably picked up the next year. Is that right?
Hopefully.
At a later stage cancer.
Exactly.
Okay.
And
interesting.
not only...
Well, this is really... And this happens all the time. Obviously, nationwide.
Yes, and worldwide, not just nationwide, and people with dense breasts. And this is our final example. This is a lady with extremely optically dense breasts. She has calcium deposits, these white areas, the white spots that you're seeing in both breasts. When they're large like that, they're benign, but she has multiple tiny, tiny ones. She's had multiple prior needle biopsies in the past. All of her needle biopsies come back benign, but I cannot tell her with any guarantee the remaining calcifications you have in your breast are perfectly okay, don't worry about them. But at the same time, I can't biopsy every calcification
So when
she has in her
comes back,
breast.
this is a woman known for having a history of calcifications in her breast.
Yes.
She comes back the next year, there's really no changes, still the same calcifications.
Right, I would magnify it. So I'd keep her as what we call a diagnostic. These are just different views
You compare it
of
to
the
the
same
year
breast.
before.
Compared to the year before with magnification, this is going to outline the calcification clusters we're looking at. And basically we came up with this plan that if there's no change, she's not going to have further biopsies of the calcifications.
And then they go home.
And they go home and wait till the next year when we magnify them again.
So with her, what happened?
So with her, she had the dense breast, we had the automated ultrasound scanner, and I offered her an ultrasound. I said, hey, let's do an ultrasound and see if there's anything in the breast besides the calcium deposits that we're following on mammography. Okay. So here's a coronal section, nipple again where the yellow dot is, and here there's a gray irregular area on the traditional ultrasound scan. And by traditional I mean it's still done on the automated machine, but this is the usual view we would look at with a handheld ultrasound. Very classic appearance for a cancer in the breast tissue. This is another coronal section a little bit deeper, and the wild thing here is there's actually 2 cancers, not 1.
Picked up by ultrasound.
Picked up by this ultrasound, correct.
Now, this is a woman also traditionally that may not have had anything beyond the mammogram because of those calcifications looked normal, or were typical in her case.
They didn't look normal, but she had been biopsied so many times before you can't, and she had so many of them,
so
you can't just biopsy all of them.
Right.
So at that point, what you're doing is looking for change, and none of her calcium deposit clusters had changed. No change.
So she would have been sent home for her cancer to grow as well.
Yes.
Really?
Yes, absolutely.
And then this is well, interesting. I haven't heard of things like this before. So this goes out nationwide. So your push, and I guess the purpose of today's program, is ask your doctor about ultrasound.
If you have dense breasts.
If you have dense breasts.
And by dense, I don't mean if they feel dense.
So who tells them they have a dense breast?
It's a very good question, and most people don't know. The answer is your referring physician. And by dense, I don't mean...
I mean, is there a scale? Is that what the doctor...
Yeah, but I don't mean physically dense. Somebody can feel their breast and feel lumpy or feel hard. That's not what we mean by dense. We literally mean optically dense as far as how the x-ray sees their breast. So it's only a radiologist who can tell you if it's dense. Could a woman that has
very soft, fatty feeling breast also have dense breast?
Absolutely.
Okay, we're going to take a quick break. We come back. More questions. I have a list of questions for you about this topic. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Marla Lander. We're talking about what you need to know about ultrasound and early detection. We'll be right back. New England Journal of Medicine, paraphrasing the article, said that a dense breast is at higher risk for breast cancer. Elaborate on that.
Yeah, this New England Journal article came out last January, and it said that women with optically dense breast have 4 to 6 times the increase